We will certainly do whatever it takes and provide whatever funding is necessary to help our NHS through this crisis, and indeed to support the whole country with government guaranteed loans, as you will have heard yesterday.
I want to thank you for the statement you just made and for the very responsible approach MPs have taken to today's question time by sitting a suitable distance apart to avoid cross-fertilisation of this horrible disease. Every member of the public will make sacrifices in the effort to stop the spread of coronavirus, but those on low pay, self-employed workers and small business owners are understandably worried. Can the Prime Minister do what the Chancellor repeatedly refused to do yesterday and pledge to increase statutory sick pay to European levels?
It is absolutely right that whatever their circumstances, we should ensure that workers get the support that they need. So in addition to the package of business support that my right honourable friend, the Chancellor, outlined yesterday, we will be working with the unions, working with colleagues across the House. We will be bringing forward further measures to support workers of all kinds throughout this crisis.
So will the Prime Minister now confirm that the government's emergency legislation will protect private renters from eviction?
I can indeed confirm that we will be bringing forward legislation to protect private renters from eviction. That is one thing we'll do. But it is also important as we legislate that we do not simply pass on the problem. So we'll also be taking steps to protect other actors in the economy.
NHS staff and those working in the care sector are, Mr. Speaker, on the front line of caring for patients suffering from coronavirus. However, sadly, those workers have no idea if they're actually transmitting the virus themselves. They may not be obviously suffering from it, but they could still be transmitting it. So can the Prime Minister please explain why the government isn't prioritising the testing of all healthcare staff?
We are prioritising testing of NHS staff for the obvious reason that we want them to be able to look after everybody else with confidence that they're not transmitting the disease. We're increasing our tests from 5,000 to 10,000 a day, and it may be of interest to the House to know that we are getting much closer, Mr. Speaker, to having a generally available test which will determine whether or not you have had the disease, and that will truly be of huge benefit to this country in tackling the outbreak.